I am repulsed today, truly repulsed by having to do this story. But we are seeing a massive COVID resurgence right now, which is leading to some countries instating health passes, new vaccine requirements, speculative third vaccine doses, and much, much more. And it's all because we aren't vaccinating enough people. In some parts of the world, because they don't yet have vaccines. In the United States, because we have so many ignorant anti-vaxxers. Here in the United States, daily cases are now up. Listen to this. 69%. 69% cases up in the United States. Globally, cases are now up 24%. What is happening? The Delta variant combined with not enough vaccination. Okay. The Delta variant is about 60% more contagious than the original variant. It's spreading, yes, mostly among unvaccinated people. That is a testament to the effectiveness of the vaccines, but it's not exclusively among the unvaccinated because the vaccines aren't 100% effective and the vaccines were not designed specifically to be tailored to the Delta variant. And right now, as many people in the United States continue to refuse to get vaccinated, things are increasingly pointed to a very ugly fall of 2021. I am fully expecting at this point, 3 months ago, I said in the fall, as we get into flu season, I would be fine with saying, hey, we've got to go back to masks at the grocery store and stuff like that. At this point, I am fully expecting that masks are coming back on in the fall in a widespread manner, unless people really go out and get vaccinated right now. Now, as a result, look at what's going on around the world. Remember, much of the world doesn't yet have access to vaccines like we have in the US. In France, the president, Emmanuel Macron, is putting in place new health rules, including the EU digital COVID certificate. Some people call this the health pass. And it's going to be mandatory if you want to go to any cultural venue. If you want to go to the movies, you will have to be using the health pass. Starting in August, the health pass will be mandatory to go to cafes, shops, and restaurants, as well as trains and planes, among other places. France is also going to require healthcare workers be vaccinated if they want to continue working around patients and in healthcare settings. In Israel, one of the most vaccinated countries in the world, they are now starting third doses of the Pfizer vaccine for the most at-risk adults. Why? It's relatively speculative. There's the idea that a third dose might provide more protection, particularly for at-risk folks. It is not something that the WHO says is indicated. The WHO says, let's keep giving first doses to completely unvaccinated people. But desperation is growing as even Israel is seeing, okay, it's a very little increase in cases. Israel is so highly vaccinated that it's not a big increase, but there are more breakthrough cases happening in Israel, as well as Delta variant cases among people who have not been vaccinated. Tennessee has now fired its top vaccine official because COVID-19 is showing signs of massive spread in Tennessee. California cases are now up 181% compared to the previous week. So is there any good news? The good news continues to be we have a tool that works really well against the Delta variant if we all use it. And when a vaccinated person does get infected, they are overwhelmingly completely asymptomatic. Most breakthrough vaccinated infections are asymptomatic. Not all. And there are vaccinated people who have died. Understand that. Now, in the US, officials are saying almost all recent hospitalizations and deaths are unvaccinated people. And that's true, but not all. And this is a community effort. This is a joint effort here. There are countries that, as they get access to the vaccine, are already seeing way more interest in getting it than we've seen in the United States. Look at Canada, for example. Canada got significant vaccine access much later than the United States, and yet they're quickly catching up to the US in terms of per capita second doses. So we need to deal with anti-vaxxers somehow, and there are real concerns about what things look like in the fall if we don't do that. Just look at the numbers. These are not vague. It's so easy to hear these headlines. Oh, it's more contagious. Oh, some people don't want to get and have some total disconnect from the fact that this means people develop symptoms that get so bad that they go to the hospital and some of them never come out. And it can mostly be avoided just by going and getting vaccinated. So the fall, I understand that this is becoming overwhelmingly a pandemic of the unvaccinated. but not completely. And it's not as simple as, well, if you don't want to get vaccinated, you're the only one at risk. That is not the case. All right. So as we head into the fall, we're going to continue watching this. By the way, also, as we head into the fall, the David Pakman Show will be hitting our 16-year anniversary, our 16th anniversary, I believe is the right way to say it. And in fact, on August 16th, we will be doing a one-day 16-year membership blowout. I would love for you to join the ranks of membership to celebrate our 16th year. And really the start of the 17th year, right? Okay. And you can be notified of that on August 16th just by getting on our membership on our newsletter. You can sign up for it at davidpakman.com and let me know your thoughts about where you see the pandemic going in the fall by sending me a message on Twitter at @dpakman.